Assalamu alaikum and very warm welcome to Ptv World Special Edition. Viewers, it is rather unconventional for a state minister to host a television program, but I decided so for a very special reason. And the reason is that there is a person that I wanted to interview myself, and he is a person from Sri Lanka. In our region, Sri Lanka and Islamic Republic of Iran has a very special place in terms of their development, and especially in development in human development sphere, whether it is health or whether it is education or whether it is other sectors of social welfare. As a student of public health, I have already studied about Sri Lanka and its success story in terms of human development and especially in the area of health. This success story has inspired generations of public health, that how a low income country has actually developed as a success story, and it has achieved universal health coverage. When I took office as a state minister in the middle of April, almost at the same time, Dr. Palitha Mahipala was also appointed as WHO representative to Pakistan as a new representative of WHO. I decided to welcome him in this unique way and to also ask him and to know from him his learnings, that how Sri Lanka had this journey and became a success story. So, I thought that rather than welcoming in a conventional way, I should actually sit with him and talk about this fascinating journey of human development in Sri Lanka, but also ask him that how he himself was part of this success story. Dr. Mahipala has served in Sri Lankan health sector development for 30 years. He started as a medical graduate in a rural area and worked through ranks, and when he left, he was serving as the Director General of Health of Sri Lanka. All through these 30 years, he saw the health sector of Sri Lanka evolving, developing and achieving all those targets that we aspire for in Pakistan. So, I thought that this is the best way to ask him and to learn from him about this story, as well as ask him also that now as a new WHO representative in Pakistan, how he see helping Pakistan also emulate that story. So, very warm welcome Dr. Palitha Mahipala.
Thank you very much, sir. Thank you very much for the kind introduction as well.
Thank you. So, let me ask you to begin with, you must have understood by now that the new government and our Prime Minister, he is so fond of the word change, and he talks about new Pakistan, and he feels very strongly about the uplifting of the common people in Pakistan with reference to their welfare, with reference to their education, with reference to their health and so on and so forth. He also talks about welfare state often. So, if I ask you that is Sri Lanka a welfare state, and if it is, what is the place of health sector and how health sector has contributed and developed in the making of this welfare state?
Let me first say it is my great honor to be here on the invitation of the Honorable Minister of Health, Pakistan, and it is a rare opportunity for a WHO representative to have been interviewed by the Honorable Minister himself. So, it is a great honor for me. And also it is an honor for me to represent my country Sri Lanka to share the success story we have had over last 20-30 years. Now, coming back to your question of state of welfare, where Honorable Prime Minister is so much interested and devoting his time and energy to make it a state of welfare, and what is the reasons behind, maybe we can take some lessons from Sri Lanka. Sri Lanka was the colony under the British ruling.
Like us.
Like Pakistan, sir. And then Sri Lankan people were fighting hard for independence. And in 1930, there was a commission set up by British rulers to say whether there can be some reforms to be brought in, probably to suppress the agitation by the people. And this commission is known as Donomo Commission, and they have suggested several reforms. First, they have declared Sri Lanka as a state of welfare. What does it mean? Two areas have been focused. One is health, other one is education. So that was a time Sri Lankan health services has been declared as a pre-service and also education. So from 1930, Sri Lanka has a free health services, and it took little time to translate the policy into action, and from 1944 it was free education.
So it's completely free.
Completely free.
For everybody.
For everybody.
All kind of health care.
Exactly.
And education.
Yes.
Including university education.
It's even beyond university education. It's primary, secondary, tertiary, university, and even postdoctoral training. If somebody get through their postgraduate examinations, the training abroad is also being spent and looked after by the government. Not only for him, even for his family to be there. So it's a free education to the maximum, I would say. The health sector started expansion of two ways. One is the preventive health sector, other one is the curative services. Now Sri Lanka has a basically little bit of a complex health services or healthcare delivery model. We have the preventive health services, which has preventive health units, and Sri Lanka has started this well before Almata is talking about the primary healthcare services. The first primary healthcare unit in the world has been established in Sri Lanka in 1926. That was with the support of Rockefeller Foundation at that time. And since then, there was two very special persons who have been involved with taking the health care to the community. One is the public health midwives, the other person is the public health inspector.
Okay, if I may just interject here, just for our viewers to understand the full context. If I ask you that has Sri Lanka today achieved universal health coverage, what would be your reply?
I would say to a great extent, yes.
Okay.
And we have preventive health care services, public health midwife looking after 3,000 population, public health inspector who is looking after sanitation and disease surveillance for 10,000 population, and then medical officer of health who supervise these two officers for 60,000 population. And we have a network of such institutions plus curative care services. We have 1,079 healthcare institutions. Sir, if you allow me to expand on this, in 1990s it was said if somebody walks 3 kilometers, he can find a healthcare institution, and if somebody walks 4 kilometers, he can find a school. So
and well functioning.
Well functioning.
Well functioning. We'll come to that. But coming back to what I asked you about universal health coverage, which was the year that you can say that that was the year that we almost reached everybody with decent health care for all citizens in Sri Lanka?
I would approach in a little different way. From 1930 to 1950s, there had been an expansion of healthcare services, especially putting up a lot of structures. But human resource, there was a lot of gaps. But then 1980s and 90s, there are a lot of focus on development of human resources, the primary health care as well as the medical education, the doctors and specialists. So maybe I would say from 1980s, 1990s, we have reached almost each and every person in the population. And I would say the expanded program of immunization, which has been founded by World Health Organization in 1974, which we introduced with basic antigens, we were able to reach as the first country in the region to reach universal immunization.
So, you have universal immunization. In
That's
other words, you do not have a child in Sri Lanka born today who does not receive the injections or sorry the immunizations which are required according to the standards of World Health Organization.
exactly, sir. Which great confidence I can tell. If not 100%, it is 99.99% coverage for all 10 antigens now we have in the immunization program in Sri Lanka.
And just to bring perspective for our viewers, this figure which Dr. Mahipala is saying that is 99.9% in Sri Lanka, currently in Pakistan it is 64%, which means that 36% of our children do not receive all the necessary immunizations that they must be receiving as their right, and this is what we are going to change. Coming back to you, sir, can I also ask you that did you in this journey paid more attention to primary health care or the tertiary level hospitals? And I ask you this for a very specific reason.
I would say both. Still, if you go by the resource allocation, it was more for secondary and tertiary care institutions, but expansion of primary health care services was also focused at the same time. I would say it's one of the reason of Donomo reforms, where adult franchise was established in Sri Lanka in 1931, I think 7-8 years after UK, where women were empowered with the same thing. And we had at that time more than 85% rural population. If somebody wanted to come to the Constitutional Council, they had to work for the rural population, and people were crying for health and education. So the political intervention was putting up healthcare structures as well as schools, and very much focused on the primary healthcare expansion. So that was one of the positive points. And the model of healthcare delivery in Sri Lanka is a low cost model. Because we have primary.
What do you mean by that?
The amount of money spent to reach the healthcare indicators today we are having, like the life expectancy for females now cross 80 years, and it is average 76 years because male die early because of the non-communicable diseases, heart disease and strokes particularly. And the IMR, infant mortality rate, which is 1 digit, 8 for 1,000 live births. And maternal mortality rate, the current year is something around 28 for 100,000 live births, which is very much equal to UK figures. But the amount of money we spent on health is $102. So if you compare, and also the GDP per capita health expenditure is as a percentage is 1.84 by the government, and total with the out-of-pocket expenditure it comes to 3.4.
And again, just to bring perspective for our viewers, the comparative values in Pakistan for the figures that Dr. Mahipala was just mentioning, if Sri Lanka is spending 3.4% of GDP on health, Pakistan is spending less than 1%. If Sri Lanka is spending $102 per capita on health, Pakistan is spending currently $37 per capita. So obviously, it's a question of prioritization, it's a question of availability of resources, but more than that, it is also that how we spend that money. Now coming back to Dr. Mahipala, you talked about life expectancy. So the life expectancy touching 80 years and 76, I mean this is like life expectancy figures that we see in well developed countries. Do you think it is a result of sustained investments in human development over the years, or is it something genetic?
I think it is the reason spending on human development, basically on health and education. Any government who were in power from 1948, that is where we got the independence, and it was successive governments always spend money on health and education, and that was two priorities. And if anybody touch on health and education, that is suicidal in Sri Lanka.
So it is so sacrosanct. And your education rate is, if I remember correctly, it is around about 94% adult literacy rate.
Literacy rate is 94, 95, male, female.
And these are those holy grails that nobody is able to touch them in your budget making, in your planning, in your decision making. So these are sacrosanct across governments, right?
Across governments.
Across governments, whether they were civil governments or and by the way, Sri Lanka also had a very long civil war.
For 30 years.
For 30 years. And how during those 30 years you were able to sustain your investments in social sectors?
Still, there were 1/3 nearly about the country geographically was war-torn areas. But still, healthcare services were provided. The healthcare workers were working, and drugs and other logistic supplies were sent by the ministry. And I remember we had freedom since 2009, where wars come to an end, and we had IDP camps for 275,000. Within few days, we had to provide healthcare services. And we organized a special immunization program. There were 37,000 children. And mothers brought the children to our immunization campaign. They didn't have their jewelries, they didn't have their birth certificates, but they brought the immunization card. And that was wonderful to see. And each and every child, even in war-torn areas, were immunized. And that is why we were able to reach zero polio from 1993.
So you had your last case of polio in 1993?
1993, sir.
Wonderful. Viewers, just to also again bring a perspective to what we are discussing about Sri Lanka as a success story of health development, Dr. Mahipala just mentioned about the life expectancy of 80. The comparative figure in Pakistan again is around about 67, 68 years. So it's a difference of about 12, 13 or more years. And same figures are actually available when you compare the incidence or the prevalence of communicable diseases, whether it is malaria, which they eradicated long time ago. We will talk about that. Hepatitis C and HIV/AIDS and non-communicable diseases. There are wide differences, and those wide differences are there because of simple decision that the Sri Lankan government made long years ago, that health is their priority. And over the years, and that's very important for us to understand also in Pakistan, that over the years when you in a sustainable way start investing in health and education, then you start reaping the fruits of these investments in the form of economic growth. So the economic growth rate in Sri Lanka has also incrementally moved upwards.
Exactly, sir.
So let's now come to something which has also baffled me, and that is that you have also very successfully controlled the epidemic of non-communicable diseases, which require really a multi-sectoral approach. Blood pressure, diabetes, cancers, they really require a multi-sectoral action. So tell us a little bit about how you have managed non-communicable diseases in Sri Lanka.
As you very correctly said, sir, it is always a multi-sectoral response, and a high-level political commitment is very much important in that. And you are very much aware, sir, that in interventions for non-communicable diseases, there are population-wide interventions where you bring new legislation, regulation, and also healthy policies. Now, in Sri Lanka, if you take the few risk factors, the tobacco, and today the tobacco warning coverage in cigarette packets is 85%. And Sri Lanka is moving ahead for plain packaging. I think that may be the next country in the region. Thailand has already declared, next country in the region to declare plain packaging. And I am very much interested the Honorable Minister's statement in the World No Tobacco Day, where Pakistan is also moving towards plain packaging, and that will have a tremendous impact on bringing down the risk factor of tobacco. And tobacco for last century has killed 100 million people. And if same trends continue, the estimate is that it will kill 1 billion people. So this is one of the major risk factor. So Sri Lanka has established in 2006 a special authority called NATA, National Authority on Tobacco and Alcohol, coming under the Ministry of Health, but basically an autonomous body to come out with legislation, policies and strategies. And also align with the global action plan, we have come out with the national action plan to address NCDs, in which for alcohol, tobacco and other risk factors, we have come out with many healthy policies. And I would say another example for fishy drinks, we came out with what is called traffic light system, again as first country in the region, and I am very much proud that I was able to put a lot of efforts in that. And that is, if a drink, ready to serve drink has more than 14 grams of sugar, we label it as red. If it is below 2 grams, we label it as green. In between, amber. So there were a lot of drinks which had to have red label, and we had to fight very hard in enforcement in this. But later, majority trained their formulation. They transformed their formulation, and they were trying to bring it down so that the sugar consumption came down. And also, the present government is working for SSB taxation. And again, I am very much impressed that Honorable Prime Minister and Sir, you as the Minister of Health, is trying to bring legislation and necessary policies to have SSB taxation, and it's a wonderful intervention to bring diabetes down in the country.
Still a long way to go in Pakistan. 57% of mortality in Pakistan, viewers, is because of non-communicable diseases, and the risk factors for this are behavioral and environmental, and they are both controllable. And a lot of legislative interventions are required, a lot of regulatory interventions are required, and a lot of educational interventions are required. And we are very determined, and the Prime Minister Imran Khan is very determined. Being a champion of building a first hospital on cancer in Pakistan, he is very knowledgeable and very committed that how we have to promote healthy lifestyles in Pakistan, which is the basis of controlling non-communicable diseases. We will have a short break. Stay with us. Welcome back. Thank you very much, Dr. Palitha, for sharing with us your perspectives and your experiences, and inspiring us with your success story of health development in Sri Lanka. Let's turn to Pakistan and your new role now. You have been appointed as a new WHO representative in Pakistan, which is a largest country in the Eastern Mediterranean region of WHO. So how you see your role in coming months and years in Pakistan, and how you think that especially your linkage with Sri Lanka and your experience of leading Sri Lankan success in health development, you think that you will bring that experience and help the government, which is very determined, but challenges are so huge, as you must have realized by now. So, tell us about your plans.
Thank you very much for accepting us, me as WR in Pakistan, where I came with a lot of aspirations. When WR position was advertised globally, before I applied, I went through the biography of the country, I would say, statistics, and I saw a lot of challenges as well as a lot of potentials. And I see a great opportunity today where Honorable Prime Minister is committed so much for health and social welfare. And Honorable Minister having so much of background on health, especially health system expert in the WHO work so many years, I think this is opportunity that we can put our experience together to improve the health services in Pakistan. As I see, there are a lot of challenges. Number one is polio. And I took it as a challenge really, and I feel that with the political leadership which is already been there, we might be able to put to a stop to this very soon. And we need commitment, and we need extra work, and if you want to have a extraordinary achievement, you need to have extraordinary commitment. So that is my number one request. We need to come together, and our role as WHO country office in Pakistan is to support the government. We are a member country driven organization, and we always extend our full support to Pakistan. And there are, as I said, apart from polio, there are many other areas where we need to focus. Tuberculosis is another area. HIV, there's outbreak which investigated by WHO-led team, and the investigation report highlight many health system cross-cutting issues like infection control, blood safety, and many other things. So we need to address it. If you address these system issues, it's not only control one disease, but it will help to improve the healthcare services delivery in Pakistan. And also the close association with you brought me more inspirations, because you are a health minister who talk about immunization coverage 100%. I came for a meeting in the ministry where you chaired, and you said nothing less than 100%. And that kind of statements, leadership is very much needed. So I feel with the scientists we have, well, best renowned scientists we have in Pakistan, and economy is also growing, I would say it's not bad, and people's commitment is there, and then the top level political leadership is there, and a very sound technical person is at the Minister of Health. So what else we need? I think we can make a change. We can transform Pakistan very quickly, and if you start to see results, you will get results very quickly, one by one. So we need to focus much on health system, and my wholehearted support, not only myself, the whole 3 levels of WHO, regional office and HQ, as a team, whatever the request made by the government, we are there to support. And it's very much interesting, and it's very much, I would say, the environment here created to us, the international partners are so much and so good, so we can work hard together with the government so that we will see definitely a difference very quickly.
Inshallah. Thank you very much, Dr. Palitha, for saying this. Viewers, as you know that political commitment is a precondition for social sector developments at large, anywhere. That has only worked wherever it has worked. Dr. Palitha mentioned about my pronouncement about not getting satisfied on anything less than universal immunization for our children, getting Pakistan polio free, getting all these blood-borne diseases like HIV AIDS and hepatitis C and hepatitis B, controlling them effectively, preventing them, and not only diseases themselves, but all their underlying factors. So in last 2 months, we have taken already a lot of such initiatives. Dr. Palitha, at the end, if I ask you, in your last 2 months, and I'm not saying this that you have to say that we are doing everything right, but I want you to candidly share with our viewers, what do you think? Do you think that the government is on the right track with reference to tackling the challenges, public health challenges that we have in the country right now? Do you think that our policies are correct and our visions are correct? Do you think that the course that we are taking in terms of controlling non-communicable diseases, especially whether it is a risk factor of tobacco or whether it is a risk factor of environmental health, what is your take on it? Do you think that we are on the right course?
Very briefly, if I answer, the government and the Ministry of Health is very much on the right track, as I see. With my experience over the last 30 years in Sri Lanka, how country can transform the health systems to give so much of benefit to the people in the country. So I see the control of communicable diseases, the health ministry and the government is on right track and have all right policies and strategies in place, but we need to translate it to action. So that is where the struggle and challenge is. So we need to translate all these good policies into action and see that there's impact created within the country. That's number one. I think number two, tobacco side, Pakistan is moving impressively well, I would say. I have a very short spell here, only 2 months. Within 2 months, I have seen so much of changes here. The Honorable Prime Minister has announced, I think, the budget, increased taxation and point of sale ban, and also so many other steps forward. So that will develop and generate a tremendous momentum. It's not only for tobacco, but for any other risk factor. And also the meetings I have participated in the health ministry under your chairmanship, I was so much impressed. Certain decisions I have not even seen in my country. There's so much, I would say, brave in taking decisions on the right direction, and it's always through the consultation process. You are invited the academia, the scientists and others to come on the board and share their views, and that is how a country can go forward. But sir, very frankly, I think on non-communicable diseases we have to do much more. It's 57% of the deaths, mortality in Pakistan is due to non-communicable diseases. In Sri Lanka very much high, it's more than 80%. Because when you control communicable diseases, automatically, eventually
the relative proportion.
So I think we need to focus more. And Sri Lanka, again, we have experience. We have introduced something called healthy lifestyle centers. First time in the world, I think probably that kind of a thing has been introduced, where we have set up clinics in the hospitals for normal people to walk in. Now hospitals are set up for patients to come in, but we have changed the mindset. Normal people, healthy people to come and get their blood pressure checked, get their blood sugar level checked, and those clinics we have health education sessions, tobacco cessation sessions, very low cost intervention by a midwife, by a healthcare worker or by a nurse, not the intervention by the doctors. We have set up such 742 centers, and also to screen NCDs and cancers for females, especially we have set up well women clinics. So those have given so much of dividend. So there are many other experience in other countries as well. So maybe sir, it's worthwhile to introduce much more focused interventions on NCDs as well.
Thank you very much for your advice, Dr. Palita, and it is indeed must be a priority, and it will be our priority. This has been fascinating speaking with Dr. Palita, who has been the Director General of Sri Lanka Ministry of Health, and who has been in the system for 3 decades, and who has seen the system evolving so well and so sustainably. We have definitely we have to go a long way, but our direction is clear, and we are very determined. And I think in the years ahead, we have to catch up a lot. We have to control our communicable diseases. We have to accelerate our action on non-communicable diseases. We have to ensure the gap that exists in Pakistan between policy making and implementation. We have to develop our health information systems, and the list goes on and on. But nevertheless, somebody has to do it. This government is very determined to do it, and inshallah, with the help of development partners, with the continued support of the Prime Minister and of all the medical profession in Pakistan, who I also see are very determined to see change happening, but somehow the system that we have developed is not allowing the good potential to be translated into action. And here we are in order to channelize whatever good exists in our system and put to the right purpose. And I very much hope that 1 year down the road, I will again invite Dr. Palitha and ask him that how now after 1 year you are seeing progress, are we on the right course, and where we need to make a course correction. Viewers, thank you very much for your attention, and we will see you once again sometime soon. Thank you very much.